Hi, everyone. Welcome back to this week's episode of The Conversation with me, Jordan Brown. This week, we'll be discussing public health with Michelle C. Burrows. She's the founder and CEO of MC²Consulting LLC and is committed to advocating for women's health equity and specializes in female empowerment and leadership. Michelle is currently the Director of Community Engagement for the University of California, Riverside School of Medicine, the Center for Healthy Communities. She leads the Center for Healthy Communities in promoting community-engaged research. The mission of the CHC is focused on remedying social injustices and health disparities that contribute to poor health of individuals and California's Inland Empire and beyond. Michelle has a depth of experience as a public health practitioner in direct patient care, community engagement strategies, state and county public health program administration, implementation, and evaluation. Michelle brings a public health career of over 25 years and is a master connector, collaborating with diverse organizations to solve complex problems facing communities, cities, and school districts with the private, public, and nonprofit sectors. Michelle has earned her master's in public health from Loma Linda University and a Bachelor of Science from Howard University. Let's welcome her onto the show. Hello, Miss Michelle. How are you doing today?
Good. How are you?
I'm doing well. I'm glad to have you.
Yes. Good to see you.
Yeah, so I guess let's go ahead and get started. Tell us a little bit about who you are and how did you get invested into looking into this public health centered side of the health field?
Yeah, so I'm Michelle Burrows. I started in public health actually when I was working back east in DC at Children's National Medical Center. And I engaged with a lot of, individuals of color that didn't have access to healthcare, and the healthcare they were getting at local clinics was not quality care. And I just realized that there were so many just disparities, in us accessing and getting good health care. And so it made me think, well, why is that? What's the reason? And I basically came up with this idea that, from the people that I talked to in the community that were coming into our clinic, is that it was all around health literacy. A lot of our individuals, our community members, they didn't understand, they didn't understand their rights. They didn't understand the things that they could do to get access to quality health care. And they just really didn't feel like they had a voice. So I, am passionate about service. And so that's what kind of got me into the field of public health, because I'm passionate about health and I'm passionate about serving my community. So I wanted to, make sure that that narrative didn't stay the same, that we were able to be literate in health and be able to, access appropriate health care.
Yeah, I think that's awesome. And it's a really powerful work, especially in the times that we're living in. I just completed a little, my work over the past quarter with UC Riverside was teaching a cultural class dealing with health in medical anthropology. And so we taught this kind of culture, health, and healing centered space. And we're really able to provide some sort of literacy for the students to be able to talk about different issues of health, and not only like how we have like biological health problems, but how where we are socially can affect our health as well. And, different situations, different intersections of where we come from can also affect our health on so many different levels. And it's really important to pay attention to that so we can understand, how do we heal our communities, going through certain things, even looking at different spaces, depending on where people live. I've heard over the past few months that people that live near meat processing plants have higher risk to cancer. And so it's like thinking about how can we literally move from the situations that we're in right now? How do we take our communities and make sure that we have healthy air quality? How do we make sure that we know how to take care of our physical bodies? How do we know how to gain a perspective of total health and working with mental health and spiritual health and and physical health altogether. So I guess my question to you is, what is this idea of total and like a holistic look of health? What does that look like for you?
Oh, wow. So you're talking about basically mind, body, and spirit. And I have launched on Black Voice News, a new show called Black Facts, and it's P.H.A.C.T.S. It's public health, awareness, culture, testimonials, and science. And I'm hoping to be able to talk to, our community about holistic health, and make sure that we understand the importance. All of it is intertwined. We have to be mentally healthy. We have to make sure that we take care of our mental health. We don't want to talk about that because oftentimes we're told, oh, that's crazy talk. Like, there's nothing wrong with you. You're just sad or whatever. But we really need to talk about our mental health. We've gone through so many things. There's so many historical traumas. There's so many current traumas, that we're experiencing in our lives. And so we have to address our mental well-being, and then we have to address our physical well-being. How are we caring for ourselves? Are we eating the right things? Are we getting physical activity? um, you know that's a component of our health. And then spiritual, our spiritual health. How are we able to take care of ourselves so that we can be calm, relax, be able to deal with all of the stress and the assaults that come at us, on a daily basis. So I'm really using this platform to be able to share, different ways that we can, like I said, take care of our total health.
Thanks for checking out the clip. Be sure to look for more on the Black Voice News YouTube page. I'll see you there. Ciao.